The Mindful Medic podcast is proudly sponsored by the Medical Benevolent Association of New South Wales, ACT. The MBA is an independent charity that has been supporting doctors in New South Wales and the ACT since 1896. They provide specialised counselling, information, referral and financial assistance to doctors and their families during times of adversity or hardship. Their aim is to provide non-judgmental support so that the doctor or family member recovers their well-being and independence and, wherever possible, returns to their vocation. Their services are free, specialised and no referral is necessary. All contact is kept strictly confidential and they are independent of any regulatory body.
And so I think, for me, outside of any formal definitions, there are lots of definitions that exist out there. I think for me, it's around, having practical skills around how do you navigate health in a way that allows you to prevent bad health outcomes, in your day-to-day life, but also that when you are unwell, where to go, how to access help, and what resources are available to you. Like, that's my definition of health literacy.
Hello and a warm welcome back to the podcast. I'm your host, Cheryl Martin. You are listening to the Mindful Medic podcast. Particularly warm welcome if you're joining us for the first time. So you have just heard from today's incredible guest, who I'm delighted to welcome to the podcast. Now, I think I have said too many times, I probably say every other episode, that the beauty for me of this podcast and being host and growing this platform and community are the people that I get to meet, the wonderful guests I get to speak with and introduce you to. But also being able to showcase their wonderful work so that we might all learn and contribute and get involved. And today's guest is no exception to that and has allowed me to tick all of those boxes. So you've just heard from Dr. Linny Phuong. Linny is founder and director of the Waterwell Project, which you're going to hear about today. Outside of this dynamic and growing organisation, she is a Paediatric Infectious Diseases Physician at the Royal Children's Hospital, Austin Health, Cabrini Health and the Murdoch Children's Research Institute. She's also a PhD candidate studying invasive pneumococcal disease in children. Prior to medicine, Linny was a qualified pharmacist, and she'll tell us a bit about that journey and story today. And she also holds a Master's of Public Health. Linny has received recognition for her work with awards including the Australian Medical Association Doctor in Training of the Year Award in 2017, the Victorian Premier's Volunteers Champion Award Leadership category in 2016, Suncorp Hidden Local Heroes Finalist in 2016, and Young Australian of the Year Victorian State Finalist in 2013. So in this conversation, we're going to hear from Linny all about the Waterwell Project, which is an incredible and award-winning charitable organisation that she founded over a decade ago, which seeks to improve the health and well-being of communities from migrant, refugee and asylum seeker backgrounds by improving their health literacy. And you've just heard Linny on her working definition of health literacy. Their core activity is the provision of free, interactive, community-based health education sessions delivered by volunteer healthcare professionals. It's across Victoria, Tasmania and New South Wales. The Waterwell Project utilises a community-centric model by working closely with refugee and migrant support organisations. Sessions are delivered upon request from community groups and co-designed alongside community partners. This means that sessions are tailored to the needs of each community group and delivered in a culturally safe manner. So I will put a link in the show notes to the website, how you can get involved as a volunteer, how you can contribute and donate to the charity. In today's conversation, you're going to hear very much more about not only the nuts and bolts and how you can get involved, but really about Linny's story, which is very mission driven as an entrepreneur and founder. And I was reflecting. I was fortunate to meet Linny just after the Creative Careers in Medicine conference, but I already knew all about her work from a colleague in Tasmania. And was reflecting on a conversation I'd had earlier on the podcast. I think it was season 3 with Dr. Raj Sundar, who is the host of the Healthcare for Humans podcast. And we had a wonderful conversation about culturally safe care and, a lot of the work that he is doing. And really struck me that the two of them are very much aligned in that mission and purpose, and both doing great actionable work. So I have introduced them, and I would love to hear them both on a podcast in the future. But what I will do is link that episode also in the show notes for those that maybe haven't already listened. And just finally, I want to thank both Linny and Raj for the work that they do and for coming on the podcast. Both of you really teach me so much about the work that we do in healthcare and how much work we still have to do. And I think aside from that, really help me broaden my perspective and worldview. So I think you cannot fail to be inspired on many fronts by Linny's work and by this conversation. So without further ado, let's get into it. Today, I am really delighted to welcome Dr. Linny Phuong to the podcast. Good morning, Linny. Thank you for joining me.
Morning. Thank you for having me, Cheryl.
So we're here today to talk about your award-winning project, the Water Well, project that you founded over a decade ago. But before we really get into that, I'd love if you could tell listeners a bit more about you and a bit more about your work. And I'm interested in your professional background and what inspired you to initially start a career in pharmacy and then medicine.
Yeah, sure.
Okay.
Goodness, where do I start? I think so much of my professional background is really revolved around my childhood and I guess how we grew up. My parents came to Australia as Vietnamese boat people, so they came in the late 1970s. And I think for them, obviously they were sent to Australia by their parents. So my dad was the youngest of 13 children. My mum was the middle of 9 children. I know, huge families. And because of what was going on in South Vietnam at the time, they could see, my grandparents could see that they, their children weren't going to have the best life if they stayed where they were. And so it's funny because reflecting back, I didn't understand what it meant to be a refugee. I didn't know when I was a child. My parents had talked about getting on a boat. They talked about pirates. They talked about living in a camp. And I don't think I really understood what that meant until I was a teenager. And that was, through kind of the schooling process that I learned about refugee health and refugee refugees coming to Australia. And so at that point, I actually sat down with my dad, and I remember at the exact day I sat down with him and I said, Mum, Dad, I really want to have a conversation with you. And I really want you to explain what it meant to be a Vietnamese black boat person. And so they, over one of those old school voice recorders, I got them to explain what had happened, how they had multiple false starts. They'd gotten on these boats, how they were jailed, after a couple of attempts, how they'd try again and get on these boats. And then that one sort of fateful day, they described getting on a boat that was like 22 by 3 meters long. It was a fishing boat. They said generally fishing boats would hold 40 people. And this particular day, there was 200 people. And my dad talks about it like being like a sardine in a can. He said they were so packed in. He, of all people, gets so seasick. And he said he had the worst seasickness and they were going through the seas. And it was, so it was 3 nights, 2 days on a boat. They ended up in Malaysia in a refugee camp. And what they describe is that apart from sort of living in tents and having to kind of barter for money, um, they described the United Nations, and I guess at that time, like what was happening in Vietnam was world news, and there was a big sort of refugee migration at that point. The United States, Canada, United Kingdom, and Australia, and a few other countries were taking refugees at that point. And so these United Nations officials apparently came to the refugee camp in Malaysia. Initially, they were offered America, and can I say, thank goodness they declined. And then there was the UN official from Australia, and they were taking young families at the time. My mum and dad had just gotten married. They were 19 and 20 years of age. And so they were flown to Australia on a plane, and they built their new lives here. And so for them, I think, to cut a long story short, it was really, they were so grateful that they had arrived in a country where they were afforded education. So they were given English language lessons, they were given access to food, they had a house, a roof over their heads, and they were given, healthcare rights. And so to start their new lives in a new country with those things, they were so grateful. The other part of that is that they had these amazing friends who were volunteers come and visit them. There were two families, and we still see them now. One family were quite poor, but managed to save up and get them a little bar heater for their housing commission flat, which they still have, by the way. That it's a really old heater. And the other family took them on trams and took them around Melbourne to teach them how to kind of, I guess, navigate being in a new city, and, where to find food, where to where to go to the doctor, where to, do all your normal everyday things. And so they have always been grateful for those two families. So when it came to kind of having kids, for them, it was really about being grateful, having, taking opportunities, and getting an education, because they felt that education was everything. They had only started high school, so neither of them finished high school, despite being very, very clever individuals. And they wanted us to have a good life. So they said, get an education, no boyfriends, no jobs. You just need to get through school and get into university, which, I think my sisters and I didn't quite understand when we were growing up. We're like, yeah, all Asian parents want their kids to do well in school and all those things. But perhaps for me, I finished school really early. I did really well at school. I finished at 16. And so I was offered an undergraduate interview for medicine at Monash, and I completely flagged. I was so young and naive. I wanted it so much, Cheryl, that it was a good thing that I didn't get into medicine at that stage. So I went and did pharmacy, because I think for me, my parents wanted me to have a career that, if like they didn't want me to do science, they wanted me to have an actual endpoint to my degree. And so pharmacy kind of seemed like a natural choice. When I did pharmacy, I really enjoyed it. I had this amazing group of people around me. And then quite a few of us actually went and did medicine afterwards. But what I found was that working in pharmacy, I really enjoyed that kind of primary healthcare aspect. I really liked having people come to me in the community and ask me for advice, despite the fact that I was 22 in a white coat and in charge of a pharmacy, because there was quite a lot of, there was so much, people couldn't believe, like, they felt that I was the shop girl because, I was this young Asian female. But they very quickly learnt, and within the pharmacies that I worked with, they learnt that I had knowledge and I was there to give knowledge and provide knowledge. And so I think that was a really kind of formative thing for me.
And I can't think of a better foundation to a medical training, particularly when you look at the climate today.
Yeah, correct, exactly. And just and then I got into postgraduate medicine, which was amazing. I feel like the twists and turns in your life, if I hadn't done pharmacy, if I hadn't gotten restless, and I even worked in a pharmaceutical company at one stage doing a medical information job. I met my husband. We both left said pharmaceutical company. We got what we wanted. We left, and
that was a win.
Correct. It was definitely a win, and he's now my husband. And we've been married for a long time, 14 years now. So, I started medicine, I think, with that primary healthcare background, with that background of my parents kind of navigating healthcare for them. And my experience of that is that as a child, I was often the child interpreter. Very inappropriate, very much not best practice. I would sit there with their dictionary, which again, they still have, like, it's this raggedy, like old tea leaf, like colored dictionary, which was in Vietnamese English. By the way, I don't speak Vietnamese. I speak Chinese to them. So I was looking up these words in English, translating to Vietnamese, actually like just passing them the dictionary and saying, the doctor's saying this. And that was kind of my experience of them seeing doctors when I was a child. So I think kind of fast forward, doing my intern year, we get exposed to everything and every specialty. And I was working in the northern suburbs. And I think for me, something that like really stuck out was I was meeting so many people who reminded me so much of my parents. They were from Italian background, from, Vietnamese background, from, early on, we had some of the earlier arrivals of some of the Somali groups, for example, and they just didn't have that health knowledge that all of us have who have grown up in this country or who, work in healthcare, obviously, and there's so much that we take for granted. And so to think that people presenting to emergency with such preventable conditions really got to me. And I don't think that that's what spurred me to create Waterwell, because I have to be really, really clear. I never set out to start an organization. That was never the intention. So that was perhaps in the back of my mind. And so the Waterwell project really started because myself and a friend, for some reason, for one weekend, we went out to a Sudanese homework club and we delivered, I say delivered now, but we actually just we had catalogs.
Sorry, what is a Sudanese homework club for me and for people listening?
Sudanese homework club. So there are homework clubs that exist across Melbourne, and it's for kids who are struggling with their everyday schoolwork. And so we were going into the homework club, and I don't even know why we were called, but what we did was we cut up, the junk mail that you get in your letterboxes, like catalogs, Coles, supermarket catalogs. We were literally cutting up fruit and vegetables and teaching these kids about healthy eating.
Wonderful.
Was hilarious, like if you think about it now, but that's all we were doing. We were like, okay, so who has Cocoa Pops for breakfast? Why is that bad? Who has fruit and vegetables? Why are fruit and vegetables good? It was really, really basic, and this is where the backstory is really funny. The following day, I went to my husband now. I went to his friend's 30th birthday party. And I was just having a conversation with his sister. His sister works for the Brotherhood of St. Lawrence. And she said, "What did you get up to yesterday?" And I said, "Well, we went to this Sudanese homework club. We were teaching them about healthy eating. We cut up some catalogs. It was really fun." And she said, "Oh my goodness, I can't believe you just said that. We have just done we've just done a needs analysis of our refugee asylum seeker population. And guess what was on the top?" And I said, "I don't know." She said, "Health literacy. You have just done something that could impact many people. Are you interested in coming in and having a chat to us about how that could look?" And I was a naive intern, Cheryl. I did not know how the system worked.
Oh, you weren't naive. You were very busy. I'm just so impressed that
I,
you actually made
oh,
this wings during your intern year.
I think I was really naive. Like obviously I had no understanding of how busy I would be as an intern and what this particular ask of me could have become.
Yeah.
And so I did it. I went in and I met with the Brotherhood of St. Lawrence and Spectrum Migrant Resource Centre. And they said, wow, like, you've just, you delivered essentially health education. Do you think it's scalable? I said, I don't even know what you're talking about here because, like I said, never meant to be an organization. So they said, you know what, why don't you get some friends together? We obviously have some groups that meet every week. We've got the Macedonian group, we've got the Italian group. We have groups from different ethnicities and cultures. And what we could do is we could introduce you and you could just come in and talk about some aspect of health.
Yeah.
And I thought, yeah, sure, easy. We could do that. And so that's what we did. So I was involved with AMA junior doctors at that point, so the Doctors in Training subcommittee. And I presented my idea and we literally got together a group of, essentially they were my friends at the time. And so had I not had that network of people around me with different expertise, it wouldn't have happened. So it was really us going out as volunteers, purely volunteers, talking to different communities. And so Spectrum and Brotherhood of St. Lawrence had, this incredible role in allowing us to really understand what we could do and the impact that we could have. And then the other great idea they had was you need to document this. You need to document what you're doing. And obviously quality is a big aspect of everything that we do. So they said, you write down what you think an ideal session would look like. And then let's recruit your friends. Let's get together. Let's educate some of the doctors who are working and are keen to be involved in refugee health.
Yeah.
And let's just see what this looks like. And so that's what we did. Somehow we then, became an incorporated association. We had a committee. We got our first deductible gift recipient status. We had lawyers come on board as like pro bono lawyers to document it all. And it took off from there. And so, it just became this thing. I think it was kind of this groundswell of activity and it was very much grassroots.
Yeah. This is a founder story. It's a startup. And it's incredible. This is the part that I didn't know. So I haven't had this part of the story. And, over what time period did you really see this blossom?
I think, initially, God, like we were a group of doctors, Cheryl. Doctors don't know much outside of medicine, can I say? Like we were so good at being doctors that, the fact that we had to learn business skills.
You've just had your MBA education 10 years ago. It's
yeah, that's right. Like we had to learn how to write grants. We had to learn how to balance budget sheets. We had to learn the principles of managing volunteers and the risks and, all of that stuff that we had never been exposed to during medical school. God, like, talking to lawyers, like it was kind of risk. And we're like, oh my God, like, what are you talking about? We're just people who want to do good and we just want to go out and talk to these individuals. And so I think very quickly, once we had sort of that structure behind us, we've had some amazing people. And I always acknowledge, some of the individuals who were involved from the start who like really got on board and, volunteered to make those calls to those community organizations and teed up some of the volunteers. And, I think our first big win was when we got a City of Melbourne grant and we finally got some money behind us to think about hiring our first project administrator. We also had translating interpreting services behind us. So, we learned very early on that the price of an interpreter at that time for, I think it was 45 minutes in person was about $150 to $180. We had $0 in our bank account, Cheryl.
Yeah.
We ran a movie fundraiser, which raised $1,000. So we were going to be out of business very, very quickly.
Yeah.
So it was all of those kind of skills and people that came on board. And I just think we had, some really amazing kind of advocates and people who believed in what we did. And so, yeah, it was just, I think we were just really fortunate.
So you mentioned that, I think that naivety probably helps, not knowing exactly what you're getting yourself into. Was there any point where you thought, oh, have I bitten off more than I can chew here? And, what was the more kind of challenging sticking points and how you kind of managed to push through?
Yeah, I think you're exactly right. Like, I think being naive meant that I didn't realize that there would be so many barriers. It was like, okay, you need to learn social media now. Great. I'll watch a YouTube clip. You need to learn how to do this. And so what I learned very quickly was that I needed smart people in the room, and I needed to surround myself with people who had different skills, which, I think I learned very, very quickly. And that's how we grew. We learned very quickly that we couldn't just have a doctor organization. We needed nurses, we needed midwives, we needed allied health, because doctors don't know everything. Like one of the, I'm sure we'll talk about some of the sessions that we deliver, but one of my best sessions was alongside a dietitian. I learned so much from the dietitian, and she learned, about the medical aspects of, what we were talking about. And so again, it's kind of, learning what your limitations are and knowing when to get help. And I knew to get help.
Oh, wonderful. I mean, I had written down these questions, but you've gone through them all as we've gone. I think, so let's fast forward. So that was that, as you say, from grassroots to really starting to get some funding and get some corporate governance around this and really think about who you need in the room. Tell us, I mean, I don't know if you want to go on to the pandemic, what kind of pre and peri-pandemic, at what stage were you at, and how did that affect your delivery of programs? And maybe let's then go into a bit more about, what the nuts and bolts of this and the program delivery looks like now.
Well, I think the pandemic was kind of a game changer and an opportunity for us, because suddenly and unfortunately there was a big highlight, there was a spotlight really on the disparities in healthcare and the health-seeking behaviours in communities from refugee background. And so, we saw in the media that during COVID-19, during the peak, that there were more hospitalizations, there were greater deaths, and there were lower amounts of vaccination uptake in these communities. And so I think that kind of spoke to the health literacy gap, and the fact that, these communities were really kind of many, many steps behind compared to the everyday Australian when it came to understanding health and disease and vaccinations, for example. From an organisational perspective, we had to pivot very quickly from running communities face-to-face in community spaces to suddenly being online. And so again, it unfortunately put a spotlight on disparities in digital literacy, because the quickest communities that we were able to convert from face-to-face to online were those who were already online, because they were engaging in, English learning classes over Zoom, for example. And I remember when we had to make that announcement within our organisation to suddenly switch to virtual. We pride ourselves when we go out into the community on having these amazing, hands-on practical resources and props that we can pass around the room and have that conversation with people. And suddenly we had to think about how to best communicate some of those, those tidbits of health, using a PowerPoint presentation with pictorials, and it's never the same. It was definitely challenging.
And ironically, your work was needed even more at that time to be able to access community groups. And it strikes me that you are uniquely poised, not only as the founder of this organisation, but as a background as a paediatric infectious disease specialist with a particular interest in preventative health and immunisation. And it just I imagine you felt that more.
Maybe that's sort of how I came to end up in infectious diseases and have an interest in public health. But the other things that we noticed during the height of the pandemic is we were hearing those stories on the ground, and we heard them early on before they were even in the media. We heard the people talking about, issues with fertility with the vaccine. We heard about drinking bleach. We heard about, scorching hot water to cure COVID. We heard all of those things within our Zoom sessions. And so I think what we did well during the pandemic is that we worked even more intensely with the community organisations. We did a huge reach out to on the ground community organisations and said, this is what we're offering. And, how can we work with you and your community? And we worked with a lot of the local government areas as well, because there was, to be fair, there was a lot of money rolled out because of COVID in helping multicultural communities. But I think for us as an organisation, we knew that the only way that this could be done well was if we consulted with community and where we didn't duplicate things that were already in place. And so, I talk a lot about kind of complementing the skills and the services that are already in place. And I think that's probably been the reason for our success, because we don't try and do, we don't do health checks.
You're working in partnership.
Correct. It's all about the partnerships, and that's so important in community work.
Fantastic. I want to go on to talk a wee bit more, because I went to one of your first face-to-face inductions that you've had post-COVID, and it was really wonderful at the weekend. And I want to talk a bit more about the logistics of what it actually looks like in practice and the work that you do. But before we do that, you asked a question just as we were having a talk before, what even is health literacy? How would you define it now?
Yeah, gosh. I mean, I think the thing with health literacy is it's one of those things that people don't understand unless they really get it. And so when we as an organisation are trying to sell the concept that we're improving health literacy, it's bloody difficult. And so I think, for me, outside of any formal definitions, there are lots of definitions that exist out there. I think for me, it's around, having practical skills around how do you navigate health in a way that allows you to prevent bad health outcomes, in your day-to-day life, but also that when you are unwell, where to go, how to access help, and what resources are available to you. Like, that's my definition of health literacy. And I think, if you, as I said earlier, like if you haven't grown up in the country or you can't read English or speak English, it's really challenging. I often reflect on seeking healthcare in other countries. Like, I remember having like a minor ailment in Italy and trying to figure out where to go and where to get help. And you look for kind of symbols and clues and things. Yeah. But reflecting on our healthcare system, God, what does it mean for a corporate looking building on the outside to be a hospital? Like, you look for that cross, don't you? Yeah. Or, but to be handed a green card being your Medicare card, like, again, like in so many societies where like plastic cards don't mean anything, like, what is this piece of plastic? What is this piece of paper that you're giving me to get some medication? Like, what is, it's all, I think health literacy is so much more than just, I've said so much more than translated information. It's around how you get from A to B to C, because if you don't get it, you kind of get stuck. And I think what a lot of us know is that we do have a really good healthcare system, but there are so many gaps where people fall through because we're not as culturally aware or as culturally appropriate as sometimes we hope to be. Even walking through the foyer of a hospital, like, all your signs are in English. Yeah. I work in a hospital where the wards are named after animals. How do you figure out where to go?
And I'm not surprised that one of your most popular sessions is navigating the Australian healthcare system. Yeah. I listened to Regina, one of your amazing community support workers, describe her experiences, and you can see she's got a real vocation, and she's an educator. And, she was talking about her personal highlights of engaging, particularly empowering local groups of women. So Can you tell us a bit more about some of the other popular sessions? What have been major highlights for you? Some of the insights, maybe anything unexpected that you have
Mm.
seen in delivering the programs?
Yeah, definitely. In terms of some of the highlights for us, I think it's always nice when the community organization, like the communities that we're in front of, feel comfortable asking questions. Often we walk, to take a step back, when we
Mm.
do sessions, we go into the community spaces. We don't have an office. We don't have like a designated space. So we will go into libraries, we'll go into churches, we'll go into mothers groups at, community centers. So we are in their spaces, firstly. So I think that sets up that safety. And then the other thing is that we are invited into their spaces. And so that's where that partnership again is really important. We have a community representative who knows the group, who understands the dynamics and the sensitivities within the group. And we go in and sit with them and allow them to ask questions. And so when we have some of the more sort of quiet groups and they feel comfortable engaging in a conversation, I think that's always that's always, a bit of a compliment really for them to feel comfortable. One of our disclaimers during our sessions is that we won't provide individual medical advice.
Yep.
And the fact that we always get asked individual medical advice speaks to that level of comfort that these individuals have when they attend our sessions. I think some of the other sort of, not highlights, but I guess wins are when community members learn something and take action. So, we delivered a mental health session where, someone was really struggling and perhaps didn't understand their symptoms and what they were experiencing. And so we were able to speak to their community representative and then get them sort of linked in with a GP and get them some assistance. So I feel like, those, even if there's, one person in the room who gets something out of our sessions, like I think that's a really big deal. Some of the learnings that we've had, I think very early on, and, we've been doing this now for 14 years, but we learnt when we were, there was a migration period where there were unaccompanied minors coming to Australia. So we had a group of men aged between 15 to 25 who were in kind of a hostel type environment. And suffice to say, they were from a background perhaps where women weren't treated as equally as they should be. And so we were asked to deliver a sexual health education, like an STI type basic sexual health stuff. So sex ed, really. And I think what that showed us and what we learned is that people come from such different cultural contexts that us talking about sex in that way was not a good thing.
Yeah.
And so these minors were in a, almost like a housing commission crisis accommodation type setting with female carers. And so what sort of ensued over the next couple of days was that they perhaps were asking questions that weren't so appropriate, and because they just didn't understand the context. And, not because they were being malicious, but because they were naive. And so what we ended up doing very quickly after sort of hearing the feedback is we started doing a session on just male-female interactions. Yeah. And, all that stuff around informed consent and respect. And so I think that was an unexpected thing that happened. And so, that was probably within our first 3 years of Waterwell. So we have really kind of learnt to lean on the community rep in being able to give us a good brief on what are the sensitivities within the group, what are the things that we need to be aware of, and sort of thinking of that whole context.
Oh, wonderful. And I think the other thing listening to you, just the insights in terms of tips to work with interpreters, which, I have worked with interpreters through my medical career, but I've learned, I learned quite a bit at the weekend, some added, I suppose, an added perspective that I maybe hadn't considered. And I think the other thing, maybe talk about both of these, but you have a project looking at safer use of medicines, and you are working with pharmacists as well. And so I found that both really important areas that, I think prospective volunteers would that they're going to get something else than just the actual experience of volunteering as well. I think
Yeah,
there's so
agree.
much.
Yeah, I think perhaps something that we don't perhaps sell, I guess is the term, as well as we should, is that reciprocal benefit of being a
Mm,
volunteer. Because, as I said earlier, like not only do we learn from each other, because, you're often paired with another healthcare professional, you learn, there's so much insight and people come with their own knowledge and experience. So it's really lovely to learn from someone else, but also you learn from the communities and you hear firsthand about some of the barriers that these individuals have. I talk about, the antenatal appointment, for example. We in healthcare use this like dreaded, I call this the dreaded FTA stamp, the failed to attend stamp. And it is a huge bugbear of mine because of the assumptions that come with it. It's, you failed to attend because you don't care about your health or you don't care enough about your unborn baby to come to your antenatal appointment, for example. And so for me, it's kind of understanding the context, which is that a lot of these women come from countries where they don't need antenatal appointments. They simply deliver at home, or they would only seek healthcare if they thought that something was going wrong, not to get, blood tests along the way or ultrasounds along the way. Like that's such almost a first world luxury that a lot of these women don't understand. And so when you label someone as a failed to attend, like what are the implications and what are you suggesting? So I think, I would implore people to have a think about that. Yeah, the stuff around working with interpreters I think is interesting. We have quite a few nurses and midwives that come and volunteer with us, and allied health, who often have not led the conversation with working with interpreters. Often it's doctor led and the nurse or allied health would be in the room. So I really like that, again, our volunteers are learning in being involved with us as an organisation.
One of my pearls from Saturday was, if I was in a hospital setting, and because interpreters might come from small community groups, if it was, a sensitive topic, potentially you can ask over the phone for an interstate interpreter. I thought that was a little
Yeah,
bit of
definitely.
gold.
Yeah, we've had women's health sessions where very small communities who have known that interpreter and where they've been a male interpreter, we've actually had to tell them to leave and contacted a phone interpreter. And we have had sessions where the group were literally like poised around a speakerphone with the interpreter like on speaker. So yeah, I think that's really important to think about small communities. And yes, we all have a duty of care and in terms of confidentiality and privacy. But some of these smaller communities where you have someone who's a community leader, like they're not bound by the same sort of rules as we are. So, interpreters obviously have a code of conduct that they follow and know that they are abiding to privacy and confidentiality. But again, like people are not going to be as open in terms of asking questions, sharing stories when they feel that there's that risk.
So I mentioned the in-person induction on Saturday. You have
Mm.
another one coming up in New South Wales, and I'm hoping to
Yes.
get this episode out before that. For people listening whose interest is piqued and would like to get involved, who are you looking for in terms of volunteers? Tell us a bit about the induction in person in Sydney and how else they can find out information and get involved.
Yeah, of course. So yes, we are delivering an induction in Sydney. I've forgotten the date, Cheryl, so you're going to have to remind
I think
everyone
it's the
later.
4th of May, but I will double check that and I will link it in the show notes.
Thank you. But certainly what people would expect from induction is to hear a little bit about us as an organisation and I guess why we exist and why, unfortunately, we need to exist at this point in time. And really, in summary, it's to get people on the same page in terms of access to health and health resources. The other things that they will learn at an induction are around cultural competency and what that truly means. Working with interpreters, how to pre-brief and post-brief an interpreter, and also just how to talk about talk about health. Like group facilitation, again, is something that a lot of healthcare professionals are not well versed in. We can have one-on-one conversations in our clinic room, but it is very, very different. So I think they will learn a little bit about that as well. In terms of who should apply, we're open. We want healthcare professionals who have an APRA registration, or dietitians, because they are, they're under the Dietitians Association. But certainly we want healthcare professionals who are interested in improving community health, and particularly those from migrant, refugee, or asylum seeker background. Brilliant. And so, I think for people who are nervous or wondering whether or not it's for them, I think, anyone who volunteers with us, really just, you're volunteering your skills and your knowledge. In that, when I was going through medical school, did a lot of like serving cups of tea in the emergency department.
And getting warm blankets.
Yeah, that's right. Exactly. Getting warm blankets, all of those things. And as much as that's nice to do, I think the Waterwell Project is a unique opportunity to be in the community, to learn from another, healthcare professional, but also to use the knowledge that you have to help other people. And I really like that sort of term, skilled volunteering. I think this is hopefully one of those opportunities.
Yeah, and so you mentioned the reciprocal benefits. I mean, I think I've been reflecting that I really wish, and I know I'm far from alone in this, I had over the years more time to really sit down with patients to develop that shared understanding, bring out the props.
Well, it's hard, isn't it? Like, you have a finite time, particularly in a public outpatient setting or in an emergency department. And really, you kind of have to get your message across and make decisions very quickly.
It's so important.
Yeah, that's right.
The missing link. So finally, just before we go on to those closing questions, I'm conscious of your time, there was one more topic I wanted to visit. I think I directed you to a question. It was actually from an emergency medicine trainee on the Creative Careers in Medicine website the other week, looking for some pointers, some advice, some direction towards some work training specifically in refugee and asylum seeker health. And, obviously I directed them to the Waterwell, and there was a few other volunteer and charitable organisations that were highlighted. But, I am conscious you actually did a dedicated training time in the Paediatric Hospital in Melbourne in this area. And, so a couple of questions. Is this something that is available elsewhere? And, given that this is probably a gap and that you're already addressing this gap in a volunteer basis, where would you actually like to see, dedicated training, and wider policy and advocacy go?
So I was fortunate to do a refugee health year at the Royal Children's Hospital. And so I worked with refugee, like kids from refugee background and asylum seekers, and really kind of, I guess, saw firsthand, working with these families, some of the pediatric specific barriers to care, and heard, a lot of stuff that I don't think I quite understood or had thought twice about. So, for example, we had these children who were struggling in school, like struggling with kind of the school structure. And if you thought about it, and if you, allowed yourself the time to think about it, these were kids who had come from refugee camps, were born in refugee camps, and had grown up in refugee camps where their day was dictated by sunlight. And so the fact that a bell went off and then you moved from room to room, and, you were kind of almost governed in some ways by a timetable, it's not hard to see why they would be failing in a Western school system. So I think it's kind of, it's really just opened up my mind to how you kind of are ingrained in society, and how there is so much, it's all the stuff around the social determinants of health. Like, there is so much around your social environment and how things are set up that affect your outcomes. And so, speaking to your question around policy, I feel like, just from a general everyday person perspective, people need to be more open-minded about, people that you encounter. Like, everyone has a story. I think that unfortunately there is an ongoing race debate, whether it's with our First Nations people or with people from different backgrounds who just look different. I think there's a lot to be said about our society and how we improve that inclusion and just kind of equity from that perspective. From a health systems perspective, I feel like we're only just starting to clue on to culturally competent care, and I find that quite confusing.
Despite mandatory modules over many years.
Yeah, that's right, exactly. And it's not, healthcare is never a one size fits all. Like, we know that, there's so many advances in like genetics and personalized care, and yet we haven't gotten the fundamentals right of communicating with patients. So from a health systems perspective, like, gosh, I would love to see hospitals be more culturally, inclusive, whether it's, I don't know, having people kind of greet you with, in different languages, having signage that is in multiple languages, or, some sort of navigator that allows you to get from A to B. And I think, unfortunately, the work that we're doing with Waterwell is so necessary just so that people are aware of what resources are available to them.
Wonderful. Where does the work go next?
Where does it go next? I think, for us, so much of what we do is about improving our quality. We're always hoping to make sure that, and we're always hoping that, what we do is we do it well. For us, one of the barriers for us as an organisation is that ongoing funding. And I know a lot of not-for-profits are really kind of suffering at the moment. People aren't donating as much as they would have, 10 years ago. Like, there really is a cost of living crisis. And so that has a flow-on effect even to the philanthropy and the government grants and all of those things that support the work that we do. So I feel like, from an organisation perspective, like, we just need to get smarter at how we ensure that we can continue the work that we do. We would love to be able to improve our reach and really get to these communities that need our help the most. So working within some of the regional centres, but really, again, we need the health workforce and we need the volunteers who are on the ground to be able to make that happen and make it a success.
And I understand that at the moment you have considerable demand.
Exactly. That's exactly right. And so they're things that we will work on internally.
Fantastic. And I know people listening to this will want to get involved. Yeah. And I want to thank you for inspiring me. I mean, I think this is a wonderful, as we've said, founder story. It's a story of entrepreneurship and vocation. And this is innovation. What is innovation? It is creating something new to the world and adding value. And that is exactly what you're doing. So thank you.
But it's a simple idea. Like, it's so, so simple. And the fact that it was scalable is fantastic. But, I was going to say, I had med students ask me a long time ago to come and talk to them about how to start an organisation. And I said, well, firstly, it shouldn't be the aim. My aim was not to duplicate anything within the system and to complement what already existed. And I think that's why we've succeeded. So yeah, like, don't go and start something new. Like, work with people who are already in the system.
But that has allowed you to start something new and bring something new.
Yeah, accidentally.
Is there anything, we do love books on this podcast, is there any reading, viewing, listening recommendations that you may have on this topic?
I do quite a bit of non-fiction reading. But I mean, God, in terms of books, like The Life You Can Save is an amazing book. I love The Moment of Lift by Melinda Gates. Definitely some of my reading has all been kind of geared up towards leadership I don't know whether that's been a deliberate thing. And then all my other reading is infectious diseases stuff. So I'm a bit of a nerd.
Wonderful. You're very welcome in this space then.
Yeah, good. I'm in good company.
We do have a bit of a focus on you, and I call it the personal prescription at the end. And you're doing a lot of things. You're doing a PhD as well, Linny,
Yeah.
and your mum, and you're running the Waterwell project, and you're a clinician. So, in terms of for you, and we talk about work-life integration, we're on this podcast now, and being conscious that it means different things to different people at different times and in different parts of their life. What does professional and personal well-being mean to you currently?
Yeah, for me, I think that coming to this as a postgraduate, and I've reflected on this a lot, I feel like I want to do things that fulfill me as a person. And so I have been in job interviews where I have talked about how I want to be a clinician and how being a mum complements my being a clinician. And that's all. It's not always been valued, can I say? But I feel like my work-life integration, my balance, which is not a balance, is about, those things that I deliberately say no to, and the things that allow me to kind of keep growing as a person, as a professional. And that's something that I'm trying to impart to my students that I have. I feel like, there's so much, there are so many amazing people in this world, and there are so many talented people. And so you kind of really just need to find where you fit in. And, it's taken me a long time, but I feel like I'm getting closer. I'm not quite there yet. But yeah, I think that's what kind of makes me feel like a whole person, and being able to as a balance see my friends and my family and have that kind of groundedness in that. That's my balance anyway.
Nice. I wish I had a Dr. Linny when I was a medical student. And finally, if you could design a self-care Sunday for yourself, and it might not be on a Sunday, I'm conscious of that, what would it look like?
My self-care Sunday would be, I think I like to incorporate exercise into my self-care. So, maybe a short session, just going for a walk, spending time with my daughter because, she's 4 and she's growing up very quickly, spending time with family and, having a nice meal. Like that's always something that makes me feel really grounded, and kind of ending that with, a book or something that's wholesome. Like it sounds so cliched, but I feel like Sundays are kind of your day to get yourself in gear, ready for the week. And so to do all those things. And then one thing I should mention is that I sit down on Sunday and I look at the week ahead. So that's my planning for the week. And until I do that, it's a big luxury, I know. But
that's very common. We hear that commonly here.
Yeah, sit down and just plan and say, this is what my week looks like. These are the bits where I have a bit of a buffer. It just kind of puts me in the right mindset for the week.
Yeah, I think that's a top tip as well. Thank you very much for your time.
Pleasure. Thank you so much for having me.
You have been listening to the Mindful Medic podcast. If you enjoyed this episode, please share it with a colleague. Please subscribe, rate and review. All of these things help us to really grow this community and platform. I will put a link in the show notes to the Waterwell Project website where you can find out information about how to volunteer and, importantly, how to donate and contribute to support their work. I'll also put a link to some of the other books and references and to Dr. Raj Sundar's podcast that we mention here. If you would like to reach out to me with any suggestions for future content, guests, then you can do so via the website, so at www.themindfulmedicpodcast.com. Otherwise, I look forward to joining you next time, where we're going to meet another incredible guest and have a conversation focused on particularly health and wellbeing at work. Till then, take care.
what I learnt very quickly was that I needed smart people in the room and I needed to surround myself with people who had different skills, which, I think I learned very, very quickly. And that's how we grew. We learnt very quickly that we couldn't just have a doctor organization. We needed nurses, we needed midwives, we needed allied health, because doctors don't know everything. I think for me, something that really stuck out was I was meeting so many people who reminded me so much of my parents. They were from Italian background, from, Vietnamese background, from, early on, we had some of the earlier arrivals of some of the Somali groups, for example, and they just, they just didn't have that health knowledge that all of us have who have grown up in this country or who, work in healthcare, obviously. And there's so much that we take for granted.
The MBA New South Wales ACT does wonderful work for those of our colleagues who are, at this very minute, experiencing a hard time. One way you can show you care about doctors' welfare is to go to their website, www.mbansw.org.au, and donate today. Knowing that their colleagues' care is a big part of these doctors' recovery, so please be part of the solution. All donations are tax deductible. If you can, please consider a monthly donation, as even small amounts collectively will allow them to plan their growth to support the increased demand.